Hello, everyone. Welcome to our webinar. Today, we have a really excellent lineup for you. This is our meeting on health notes and examining policies effects on public health. Today, we have Dr. Keisha Pollock-Porter with us today. She is a Bloomberg Centennial Professor and Chair of the Department of Health Policy and Management at the Johns Hopkins Bloomberg School of Public Health. Dr. Pollock-Porter is an expert in advancing health in all policies and promoting policies that address social determinants of health and health inequities. She has been a consultant with the Health Impact Project, a collaboration of the Robert Wood Johnson Foundation and the Pew Charitable Trust since 2012, and is presenting today on behalf of the team. We also have Susanna Groves, who is the Deputy Director for Research at the Council of the District of Columbia's Office of the Budget Director. She has been with the office for 6 years, where she has also served as a senior budget analyst. She holds a BA from the University of Michigan and an MPP from Harvard University. And our final speaker today will be Amanda Woodrum. She is a senior researcher for Policy Matters Ohio, focusing on issues found at the intersection of health, equity, climate, and the economy. She is also a co-director of the Project to Reimagine Appalachia, helps organize the Health Equity Network of Ohio, and sits on the All Abroad Ohio Board of Directors and the University of Akron's Department of Economics Advisory Board. She conducts research, advocacy, and coalition building around the role of transportation, energy, health, and anti-poverty policy can play to promote a more sustainable and equitable economy in Ohio. So we have some really wonderful presenters today, and I'm very excited to hear from all of them. You can please utilize the chat if you have questions or comments for any of our presenters. This platform is just like regular Zoom meetings, so please feel free to utilize the chat for your questions, or there's also a Q&A button just to the left of the chat button, so you're also free to use that as well. I'll be taking a look at both. So we'll have Dr. Pollock-Porter start. I'll kick it to you.
Great, thank you so much, Sydney. Really appreciate the very warm introduction, and thank you all for being here today. I'm going to go ahead and share my screen and a brief presentation on the health notes. As Sydney mentioned in my bio, I have been a consultant with the Health Impact Project, a collaboration of the Robert Wood Johnson Foundation and the Pew Charitable Trust for several years. And the Health Impact Project is a national initiative that really aims to reduce health inequities and improve the health of all people, ensuring that health is a valued and routine consideration in decisions affecting them. And the project uses a number of strategies to achieve this mission and its goals. And today I'll talk about the health note, which is aligned with this overall goal. As Sydney mentioned, I am presenting today on behalf of our team, and I want to acknowledge my collaborators, Ruth Lindberg and Stephanie Kerrigan, who are also involved with this work. Some of you may have seen this report that came out at the end of 2011, and this is from the Bipartisan Policy Center. And it was really around looking at how do we move forward as a public health system, and what needs to be modernized to better respond to the challenges that are facing this country. In that report is the following sentence here on the screen. I won't read it verbatim, but what I want to emphasize is that this report called for a need to partner with various sectors, connect public health with housing and food and transportation, with community, if we really want to be able to achieve health equity. And by health equity, I'm talking about assuring the conditions by which every single person can thrive and be as healthy as they possibly can, regardless of where they were born, where they grew up, where they were raised, where they went to school, etc. What I'm excited about in this report is that there were a number of recommended actions. This slide presents two of those, and one is related to an area where I spend a lot of my time, and that's around How do we lift up health in all government sector policy discussions? On the slide, we see two very specific recommended actions calling for the consideration of health into policymaking. The first point A mentions integrating and articulating health considerations into the policymaking process across all government sectors. And the second point B on this slide is to conduct health impact assessments on legislation. You may be familiar with the health impact assessment. I have consider myself a health impact assessment or HIA practitioner and researcher, but an HIA, just to make sure we're all on the same page, is a structured process that uses scientific data, the best available data, professional expertise, input from a variety of stakeholders and community members to identify and evaluate the potential public health consequences of proposals. So how could health be impacted either positively or negatively? And HIAs suggest pragmatic actions that could be taken to minimize those negative health impacts and really maximize the beneficial ones. Health Impact Project, for many years, been doing HIAs. And one of the things that we recognized is that there was a lot of potential for HIAs to be used and applied to policies. However, there are challenges in the policy-making process that made it hard to do a health impact assessment. In particular, I've worked in the Maryland Legislature as a staffer on a member, and the legislative session is really short. So that doesn't even allow enough time to do a real comprehensive or robust HIA. And so several of us began to ask, well, what are the best ways that we can leverage the standing processes in policymaking and to bring a health lens to the work? As many of you know, I suspect and I'm positive that you're familiar with things like fiscal notes for bills. And so a colleague and I began to talk about, well, what if there was a health note for a bill as well? And that's where this work really grew from. So a health note is designed to help policymakers understand the health implications of proposed bills. And this effort really focuses on bills outside of the health committees because often the local and state public health departments are actively tracking those bills. It's the bills in other committees, education or energy, that also have implications for health that oftentimes are not articulated or lifted up during the conversation. We created a health note to provide brief, objective, nonpartisan analysis and to bring evidence about health and equity to the policymaking process. I'll talk a little bit about the pilot process that we initiated, and we'll be able to share with you how we are trying to fill this important gap with health notes in terms of what we can bring to the process. For example, if we didn't have a health note, what would that mean? Well, this is how we think health notes help. Health notes systematically take into account the health implications of proposals being discussed. Again, as I just mentioned, outside of the health committee, oftentimes the potential health effects of bills aren't always brought to the forefront. Health notes can also be used, the findings from them, to generate ideas for more research on legislative topics, can help identify gaps, for example. The findings can also help the public better understand how specific bills or proposals might promote, protect, or harm health. These notes draw on the best available peer-reviewed and scientific data and sometimes gray literature to highlight ways that public health can be impacted by bills in these other sectors. When we started on this journey to create a health note, we went through a process that involved many formative steps. And what we learned from partnering with NCSL many years ago, from conducting key informant interviews with individuals with expertise with legislatures and engaging a group of advisors, we learned that there was a lot of support for the concept, but certainly questions about implementation. We also learned the importance of buy-in and relationship building, that we needed to spend some time to make sure people understood what we were doing and why it mattered. We also learned the importance of omitting recommendations, that we were really targeted, our goal was to present the scientific evidence, and not provide recommendations on how to change the bill, for example. We also heard that we needed to ensure that the analysis is perceived as objective, and that we needed to pay attention to the entity that completed the analysis, because they needed to be perceived as credible, nonpartisan, and objective. And we also emphasized the importance of the screening process. What do I mean? Well, I mean that every single bill can't automatically receive a health note, right? Oftentimes there's not enough capacity to do that. So we had to ask, well, what are the criteria by which a health note would make sense? And we developed screening criteria. I mentioned this pilot. So back in 2018, the project put out a call and worked with NCSL and other partners to partner with states or localities to build capacity for conducting health notes. We identified a sustainable process, so we sought to identify a sustainable process to apply the health note to the legislative process. And we sought agencies and organizations that had the capacity to screen legislation and draft health notes. We started this pilot by focusing on 4 sectors. So that was education, labor and employment, housing, and land use planning. These were 4 areas where the evidence was very clear, where the project had a toolkit that summarized a lot of the evidence. We were able to really draw on that. This image here on the slide is a brief that we created at the end of 2017, describing the health note and our pilot. We spent some time creating methodology. And I would just say we have described in this guide that you see an image of on your screen very clearly how to conduct a health note. Just yesterday, Stephanie and I did a training, and this is such a great resource. You can pick this up and see how to engage in the 6 steps that we created for the health note. And these steps are very much based on the HIA process that I mentioned earlier, without the recommendation step, and really without the stakeholder engagement that is part of the HIA process. Health notes are conducted very quickly, and the only engagement we have usually with people outside of the team is with some subject matter experts. But the process involves screening, involves scoping to understand how the bill could affect drivers or determinants of health and health outcomes. It also involves doing the research, so doing the literature reviews to pull together the evidence. It involves drafting the document, which it can be pretty short, depending on how complex the bill is. We have health notes that are anywhere from 6 to 10 pages or so. So we do recommend having a sort of short summary up front. And then we disseminate the note. Ideally, we want to get the note to the policymakers at least a week in advance so that it can inform, for example, a bill hearing. And then, of course, we have been monitoring and evaluating the process, and we encourage people to do that as well, to refine the methods so that they can really be used most effectively in the process. I mentioned our pilot started in 2018, and through 2019, we worked with partners in Indiana and Colorado. In 2019, we partnered with the Center on Budget and Policy Priorities and worked with policy organizations in California, North Carolina, and Ohio. And you'll hear from Amanda, who's from Ohio and was our partner there shortly. We held a convening in December 2019 to share lessons learned across these partners. And then we partnered with the DC City Council since 2020, and we'll hear from Susanna about their experience working with health notes shortly. And then we've been evaluating stakeholder perspectives on the notes. To date, there have been 20 health notes completed over this time. The Health Impact Project, we've been involved with 13 of them. Our colleague Amanda and her team at Policy Matters Ohio have done 2. And then you see the other teams here on the slide. All of these health notes are available on the Health Impact Project's website. I will drop the link in the chat for you so that way you can access them and take a look at what these health notes are covering. Before I wrap up, I want to share with you some of the lessons that we've learned as we've evaluated our work. And I say so far because we are continuing to do this work. We're continuing to refine our approach and make sure that we can be most effective in bringing health and equity to the policy process. So we've heard from policymakers, stakeholders, individuals involved in these notes that they are generally easy or very easy to understand, and they're well researched. These are heavily cited, there's a lot of citations, involved in creating the notes, so well referenced. We also heard that health notes provide a fair and objective assessment of the health impacts of the proposed legislation. And again, lots of sources to support the findings and that they're credible sources. We use the best available evidence possible to put together a note. We also heard that the data and evidence that are included in the health note are not otherwise available to legislators. So this really supports a gap that the health notes are filling. So bringing new information to the legislative process. Some individuals said that the health notes informed how the bills could affect health. Others said that they didn't because they were aware of those impacts. But for people who were unaware of the connections with health, they found them very valuable. And finally, we heard that the impact of health notes could be strengthened if we modified their format. For example, adding a one-page executive summary. Because while people were interested, reading the 10-page note just wasn't feasible in terms of how busy policymakers were. But we heard, again, the importance of having a summary. We also heard the importance of thinking about the timing and making sure that the health notes are delivered far enough in advance where they could be reviewed and really thought about before a bill hearing, for example. Finally, we heard from some policymakers, really thinking through how we can increase awareness of health notes. That is my summary. I know I went through those slides pretty quickly, but I wanted to just set a foundation for the two speakers that will come after me. You'll hear from Susanna and Amanda about their experiences on particular policy topics using the health notes that I just described. Thank you very much. Here's my contact information. If you have questions after today, I'm happy to engage with you and to talk more about the health notes. And I look forward to the questions and answers today. So thank you.
Thank you so much, Keisha. That was such a wonderful overview of the history of the health impact assessments and health notes. So really appreciate your perspective on that. Now we are going to transition over to Susanna Groves from Washington, D.C. So Susanna, the floor is yours.
Thank you so much, Sydney, and to NCSL for this convening. I'm honored by your invitation, and I'm grateful for this chance to share the Council of the District of Columbia's experience with a powerful analytical tool called Health Notes. Oh, I did not start screen sharing. Let me do that. Here we go. The District of Columbia is not only the nation's capital, we are also home to 700,000 people. We are US citizens who pay federal and local taxes, and we serve in the military. However, we are not a state, and we do not have full voting representation in Congress. I work for the Council of the District of Columbia. We are an elected legislature that enacts laws and sets policies on behalf of the residents of the District of Columbia. We perform the functions of a state legislature, a county council, and a city council all rolled up into one. In other words, we oversee everything from Medicaid to trash collection. We are a unicameral body that works full-time year-round. There are 13 council members, 10 committees who are supported by 214 staff. We first learned about the Health Impact Project in July 2019, when my boss, Jen Budoff, and I met Ruth Lindbergh at an APAM conference. We formalized a technical assistance partnership the following spring during the early months of the pandemic. The Health Impact Project agreed to provide the DC Council with up to 5 health notes on legislation being reviewed during council periods 23 and 24. The partnership was with Chairman Phil Mendelson, but I have managed its day-to-day operations. To date, this partnership has resulted in health notes on 4 pieces of legislation that were not explicitly about health, but nevertheless have the potential to affect the health outcomes of district residents. The health notes looked at a transit bill, which would provide residents with up to $100 a month in public transit subsidies and improved bus service. Second, a baby bonds bill, which provides subsidized wealth building accounts for children in low-income households. There was a bill that was set that sets the city's 20-year growth and development blueprint, and a bill on that does policing and justice reform. Of these 4 bills, 2 have been enacted and 2 are under committee review. The council has really benefited from this partnership with the Health Impact Project. Health Notes have provided us with in-depth analysis on 4 really significant pieces of legislation. They point to the bills as often overlooked connections to health. For example, the Baby Bonds Health Note found promising research that automatic enrollment in child development accounts can improve both child and parent well-being. They can begin to address racial wealth gaps and could benefit health over the life course. Health Notes break out the legislation into its component parts and summarize the related research. I really like that they classify the strength of the findings, saying if there is strong evidence, mixed evidence, or if the topic has not been thoroughly researched. As Keisha pointed out, the Health Impact Project also has access to all these research articles and databases that we simply do not have as with the legislature. So that has been a really great asset as well. I really appreciate that they are nonpartisan and neutral. As a legislature, nearly all of the analysis of bills that we receive from organizations outside of the government and from constituents comes with some kind of partisan position, a policy agenda, or maybe an advocacy goal. There's nothing wrong with that, but Health Notes are so refreshing because they do not bring that partisan lens and they do not offer an advocacy filter. They really separate fact from fiction. Health Notes have been a great resource for council staff. Personally, I've benefited from the technical assistance that we've gathered from this partnership. Working with the Health Impact Project has sharpened my research skills, taught me ways to improve research methodology, and made me a more effective communicator. Like all legislatures, we have limited resources and staff at the council, and this partnership has really augmented the body's research and analysis capacities. I've heard from colleagues that they've used Health Notes to understand complex legislation and prep their bosses for meetings and hearings. They've also turned to Health Notes to draft talking points for the council members and write committee reports. However, Health Notes are not without their challenges. I'm going to speak to 4 of those challenges today. First, it can be difficult to identify the right legislation for a health note. For example, we had to turn down a number of requests because the proposed legislation was about health, or it sought to set up a task force. It can be difficult for colleagues to understand that something called a health note is for bills that are not about health. Second, health notes are a trust-building exercise. When I started approaching colleagues about doing a health note on their non-health bills, at times I was met with skepticism and concern. Staff were worried that they would lose control over their bill's narrative. They were afraid that if the health note did not go their way, as they called it, the tool would embarrass their boss and undermine their policy objective. It's possible that these fears were especially great during the pandemic, when public health policy has unfortunately become a political lightning rod around the globe. It's also really difficult to know when in the legislative process to begin a health note. If you do a health note on a bill in the very early stages, when it's just being drafted, you could end up dedicating a lot of time and resources to a bill maybe is never introduced or dies in committee. You may be doing an analysis on components that don't make it into the bill's introduced version. However, if you do a health note on a bill that is clearly moving forward, the bill might already have so much momentum that the debate has already happened, and the health note comes out too late to inform that discussion. Fourth, we have a challenge around sustaining health notes as an analytical tool once our wonderful partnership with the Health Impact Project comes to an end. At this point, we do not have dedicated staff to conduct health notes, but we have learned a lot from this partnership, and there's an opportunity to include the tools and skills that we have learned from this collaboration and other analytical research projects that we regularly produce within the legislature, such as policy and economic impact statements and racial equity impact assessments. Here's my contact information. I'd be happy to speak with anyone offline. Thank you so much for this opportunity to join you and share my experiences with Health Notes. I'm deeply grateful to Keisha Pollock-Porter, Ruth Lindberg, and Stephanie Kergnen. Thank you for all of your work in putting out these 4 Health Notes. You've been such incredible partners and willing and patient teachers. Thank you.
Thanks so much, Susanna. That was wonderful. Our final presenter today is Amanda Woodrum. Amanda, the floor is yours.
Thank you, Sydney. I just want to start by saying that the purpose of government is to promote the health and general welfare of its citizens and its residents, but we know very little about whether we're accomplishing this goal. And often when we think about health, it's associated with health care. When we think about health policy, and we think about access to health care. But I think as a society, there's a growing understanding that in fact, poverty is bad for health, as is racism. And then that we have these segregated areas of concentrated poverty that exist throughout the country and exacerbate these health issues, and a growing understanding that policy has played a role in creating that situation. The good news is that also means better policy going forward can help ameliorate and solve the problem. And that starts at a very fundamental level of having better information. Now, health equity assessments can be conducted at administrative levels, administrative decisions like from planning to community and economic development. But in Ohio, we really wanted to start with the legislature first. And the reason for that was because that's where the most fundamental policy decisions get made. But I think it's important to understand when it comes to health equity assessments, what something like a state agency is capable of accomplishing is very different than what can be accomplished by the state legislature. So we were really excited when Pew Charitable Trust and the Health Impact Project reached out to us because, you know, in Ohio, fiscal notes are routine for almost every bill that gets put forward. So the idea of its counterpart with the health note makes a lot of sense. And essentially, Keisha didn't really totally get into this, but I'd say a very compact lit review in effect, instead of like there's not a lot of deep data analysis. It's because that is not the kind of thing that you're going to see the Legislative Services Commission undertake. And so it's a really simple process and capable of being done in a very short period. And so that is very important. So I'll just talk about a few things that, you know, we had to consider as part of this process. We modeled it in Ohio just to have examples that our legislators and legislative services could look at. And we picked a couple bills to model that aren't normally associated with health. So criminal justice reform was one of them, and workers' comp was another one, just to make the point that all the things that we do, all the policy decisions we make have an impact on health. And then we worked with our Health Equity Network of Ohio, and in particular with the Ohio Public Health Association, as well as other sort of key anti-poverty groups, to put forward tools that the Legislative Services Commission could do to replicate this model, and then draft legislation. We identified a legislative champion who was, you know, very passionate about this issue, and as we started to work with her to draft the legislation, we had to work through a couple key issues. One is, what would be the trigger for health notes? Fiscal notes, for instance, are pretty routine, so you could have, health notes basically required on every major bill. Another way of doing it is triggered upon the request of a legislator. And in fact, we started to think about maybe what we should do is a pilot project, and we do 10 to 20 over the next 2 years, just to work out the kinks in the model, work with Legislative Service Commission. And that sort of leads me to the second thing we had to think about is a budget, because the Legislative Services Commission didn't have capacity to do this unless we gave them the capacity to do that. And so we started to think about what is the capacity that would be needed for this, a pilot project. Maybe somebody could do that with just one part-time staff, some management oversight, maybe some communications editing, and then, as Keisha pointed out, resources like access to health literature to figure out how an impact of a proposed bill might be associated with health impacts. And ultimately, we ended up deciding that we were going to at least start with going for these health notes being conducted on every bill. And so we're gonna have to think a little bit bigger about the budget, maybe a full-time staff. In our mind, we were thinking a health equity expert, a part-time staff, some management oversight, and still the access to resources, but still it's pretty modest budget. And ultimately, we also had to think about some messaging. The tool itself considers health and equity, but our champion in the legislature did not feel that the word equity would be helpful in the legislation, that it might become partisan and a non-starter in some folks' eyes. So we didn't use the word equity in our legislation. Health impacts, health notes, that sort of language felt more bipartisan, or have less of a partisan feel or impact. But it did, in fact, look at distributional impacts of those health impacts, and so had a built-in component that folks would think of as equitable. Our initial strategy was to get it into the budget bill, which is big, it's massive, has many moving pieces and parts. This is a fundamental change in how the legislature would conduct business. We thought it might be best to sort of go quietly under the radar, and since it's relatively small budget ask, it wouldn't be too controversial in that sense. And we were fairly optimistic that we would get it into the budget, but then the pandemic hit, and our public health experts ultimately spread into the wind to put out the many fires. And so that sort of put the kibosh at that time. But we have sort of in the meantime regrouped 2 years later and are thinking about how health and equity impact assessments can help guide ARPA spending decisions, the COVID recovery bill, which has limitations designed around folks that were disproportionately impacted by the pandemic, which really is about low-income households and people of color were disproportionately impacted because of these social determinants of health and the underlying conditions they cause. So, and that ended up resulting in more severe impacts associated with COVID. And so we think that health and equity assessments can be a really valuable tool in making spending decisions when it comes to ARPA. And with that, I'll wrap it up.
Thanks so much, Amanda. That was really insightful. So let's answer some questions, maybe have a little bit of a discussion. Really excited that y'all are here. So, Amanda, you kind of talked about working at the partnering with local entities. And so I wanted either Amanda, Susanna, or Keisha, how can the legislature work with their local entities to kind of make them aware of health notes, what's been going on at the states, how can they partner together? If anyone wants to start with that.
Well, as I mentioned, we've been working closely with the Ohio Public Health Agency or Association, excuse me, and they're an association of public health departments across the state. As well as other public health entities, and they are very excited about health equity assessments and the use of them. And they're all over, they're everywhere. And so they are an excellent partner in taking this work to the local level as well as the state level. And we're working closely with them to do that.
Sydney, I'll just add another perspective to this in addition to what Amanda shared, which is in Maryland, we, like many other states, had a health in all policies commission or work group. And that has actually, through some legislation, merged to a health equity work group for the state. And I had the privilege of briefing that group, which includes various agencies, community members, different organizations, and talked about the health note and how a tool like a health note could help to advance some of their health equity goals for the state. And what was exciting about that is that group includes representatives from a variety of sectors, right? So the kinds of sectors that were mentioned earlier, criminal justice, planning, housing. And so talking about how they could use the health note to look at some policy proposals in their areas was one way. And we talked about how that could happen at a local level, involving communities to address some state legislation.
I'm still muted. Thanks, Keisha, for those additional comments. So as Susanna, as a legislative staffer, what can you dive a little bit deeper into kind of what can a legislative staffer's role be from kind of beginning of a health note? Do you would a staffer be able to reach out to Pew or another organization in their community? Does Pew or another organization approach the legislature? And then kind of what's the legislative staffer's role in kind of as the health note moves through the legislative process? Can you kind of talk about that a little bit?
Sure. I mean, I think we have a different perspective than what Amanda shared in that at this point, the council has not been producing our own health notes. The Health Impact Project has very generously done that for us on our behalf. So how it's worked to date is I've been, as a legislative staffer, I follow the bills that have been introduced and where they are standing, and have pointed the Health Impact Project to, the first filter out if that's a potential bill, and then going to the author of that bill or the committee that has jurisdiction over that bill and seeing if this would be of interest. I've also, let everyone in the body know that this is a resource, and that we've met with a number of different committees and council members' staff to let them know about health notes. So at times, a council member's staff will come to me and say, would this be an appropriate bill? And often once we put out a health note, there's renewed interest. And this partnership has only been going on for 2 years. And as I said, it started, we signed the technical assistance agreement in May 2020. So we've been fully remote until February of this year. So I think a lot of the kind of informal interactions that you'd have and with other staff and to promote the health notes have been lacking just because of like the work from home posture.
Yeah, kind of, I remember NCSL, we were working with our colleagues from Pew right before the pandemic started, December 2019. And, it was everything, COVID, like everything, right? COVID just kind of threw everything for a loop. And so, it's kind of, it's really great that y'all have just continued the work on this and continued to move it forward. That it's really great. Thanks, Susanna. That's really helpful, especially as thinking about like fiscal analysts in the states, they're the ones doing the fiscal notes. And, so the legislative staff behind the scenes really have a big role to play, in moving the health notes forward in the legislature.
Well, my office also conducts fiscal notes. And so it's been interesting to add this to our like repertoire of resources.
Oh, well, then I'm going to ask you that. How is that if an agency is doing, but you're doing a fiscal note and a health note, do you try to keep them separate? Would you ever combine them? Is it, what's your workload like on that? Just kind of curious.
Well, that should be an asterisk. So we do fiscal notes, but only on a small subset of legislation. So we only do it on something that's sort of unique to the district, that we have something called emergency and temporary legislation, which is only in effect for a short period of time because Congress has to review every piece of legislation. So this is kind of a stopgap measure. So our office does the fiscal notes on those and then amendments, but the fiscal notes on permanent pieces of legislation are done by a different office, by the Office of the Chief Financial Officer. So the sort of in-depth fiscal note happens elsewhere, not within our office.
Great. Yeah, that makes sense. All right. We have a question. Let's see. So several speakers talked about pros and cons of health notes, but I'm curious if you can talk about key lessons learned that may be helpful for state policymakers. What's been the greatest benefit and impact, and that's a great question. I think, we hear questions from our legislators a lot of like, what's the impact of this piece of legislation? What's the impact of that? A lot of like evidence-based policies and things like that. So that's a great question. Anyone feel free to jump in.
Well, I'll just start by saying it's really important to have a full and fair analysis of all the key impacts of proposed policies. And in Ohio, we have the fiscal notes and we often have business impact analysis. But one of the things I think if we only ever consider the business impact or the impact to business for proposed policies, that we don't have the full story. And so we need that health impact as to get to that full and fair analysis. And that's the kind of information legislators should have at hand to consider when they're making policy decisions. And at the very least, use that information to amend or adjust the legislation accordingly to reduce negative impacts or grow the positive impacts.
Yeah, and I'd like to amplify Amanda's comments and say, fiscal health notes can provide legislators an opportunity to identify otherwise overlooked opportunities to promote the health of their constituents. Right? Like we think that health considerations should be elevated to the same importance as fiscal or economic or business considerations, which are routinely considered in the legislative process. And so again, we think it's important to amplify the impacts of health as well, potential impacts on health as well. As far as, I mentioned earlier, we're evaluating the health notes, so we're still collecting evidence of the impacts, but certainly we know that our data has been cited by legislators. We know that it's, increased awareness. And so certainly we are interested in knowing how bills might be changed due to what evidence that we're presenting. But we're still at the early stages of learning how these are being used. But certainly we think it's critically important to elevate those potential health impacts. And we think that it's important to do that for the people who are being represented by elected officials.
Yeah, I mean, I think the pandemic has really brought to focus for all of us how health impacts everything. And it's very fortuitous that we started this partnership right at the beginning of the pandemic, and that when the body has been so focused on health. And at the same moment that there's been so much more attention and an understanding about the really significant racial gaps that we have in the district, particularly around health. And so having this additional analytical tool to not only help with the 4 pieces of legislation that there were health notes on, but to get members and staff to be thinking about the health lens on other pieces of legislation that we didn't have the opportunity to examine, but just, overall informing the debate and planting a seed.
Yeah. And Sydney, maybe I can just add one more thing. I really want to amplify a comment Susanna made about how the health notes have two sections I think are really relevant for policymakers. One is a section around how might the impacts be disproportionately affecting certain communities, right? So certainly looking at potential impacts on racial equity, gender equity, looking at differences between rural or urban residents, or really looking at all those differences. So that's part of the analysis. The second thing is the health note model that we have says, well, what do these data mean for this jurisdiction? So we really try to bring in that local contextual data. So again, providing some new information oftentimes for policymakers to know, okay, well, here's what could happen to my district. And we really try hard to get those local data.
Yeah, that's super helpful. Keisha, I kind of want to ask you with, Susanna kind of is bringing the legislature aspect of it, and Amanda bringing kind of that external organization, non-legislature aspect. So how, if, because I've seen, in Ohio, I think Washington, maybe North Carolina, y'all have used not necessarily the legislatures producing the health note, it's that external organization. So how does that process work when it's not necessarily the legislature that's doing the health note, that it's an external? And how does that relationship between the external organization and the legislature work? And Amanda, that you can also feel free to jump in with that too.
Yeah, maybe I'll just start by sharing what a great opportunity for partnerships, right? And so, I'm at an academic institution working with the Health Impact Project. And so as an external group, Health Impact Project is very committed to evidence-based policymaking and pulling together the best available evidence. And so we have the research expertise in the Health Impact Project to pull together evidence. We are a trusted entity. So whether or not you are partnering with that Health Impact Project or your local academic institution, they have access to those resources that may not be readily available. So for example, we often hear sometimes about the limits of accessing journal articles, for example. Many journals are behind a paywall. Well, as an academic institution, we have subscription access to those things. So we can pull those data. We can really dig into the literature and pull together a comprehensive assessment of all of the ways health could be impacted. So I would just say, really, the partnership is so critical. Susanna mentioned that with the Health Impact Project, and we heard Amanda's examples too about partnerships. And I would say this is around the trust building, around really helping to describe why this analysis could be useful. And then for me as an academic institution, I also involve my students. My students are learning how to do these assessments. A few of them got some academic credits. We also do racial equity impact assessments. So it's really great for them to learn, and we're providing a need to organizations that don't have the capacity to do these analyses themselves.
I'll just add a couple of thoughts. One is, I think at the end of the day, it's really important that government bodies, whether it's state agencies or the legislature, undertake this work because it really needs to be an official part of the policy making process. It of course doesn't hurt to have other people, who can compare notes and have other organizations do it. But before it is prevalent everywhere and it's, trusted to be done right, there's a role for other organizations to model the behavior, make sure that the right information gets out there. That's why Policy Matters undertook this effort to model it. And as we go towards trying to get health equity assessments to be used at the local level, we also see, having public health agencies at the local level playing a role here, modeling the behavior, working out the kinks, helping develop the model. And then the more communities that start making this an official part of their process, we can bubble back up to the state level and try to get it done there. But we'll come with a lot more experience in the model.
Great. Yeah, thank you. And Susanna, thank you for putting DC's health notes in the chat, so you all can find those directly at the District of Columbia's website. I just shared one from the Pew website that I had, so I appreciate you being able to share. I also wanted to let you all know that all of the health notes that Pew has partnered with, either with the state legislatures or the external organizations, are available on their website as well. I just have a wrap-up question as we're kind of nearing time is, Keisha, where do you envision this going? What is the future of health notes? Are you all partnering with more states right now? Are the states that you have been working with, are they continuing to pursue health notes? What is the long-term goal of this project?
Yeah, thank you for the question. I would so yes, it's my hope that health is routinely considered during the legislative process, right? So ideally there's more opportunities, or people want to do health notes and do these analyses. So, we are continuing to provide support. Yesterday, Stephanie and I did a training for some colleagues in mostly Nevada, and some colleagues from Susanna from DC were on there too. So there's still interest, which we're really excited about. And so I would just say, reach out. We're happy to have conversations and to see if there's opportunities for training. But for me, it's about what's the goal, and the goal is to help to improve health and well-being and health equity and address inequities. And I think this is one way to help us get there. So absolutely excited for the future of health notes. To us, this wasn't just a pilot. This is an effort we would love to sustain and see other states embracing this effort.
Yeah, that's really great. Awesome. Well, I don't see any other questions. And Keisha, if there's a legislative staffer or a legislator, or even someone on here who works for an external organization that thinks this would be a great idea, how can they get it? Can they get in touch with you? Can they get in touch with Stephanie or Ruth? What's the process that someone can go through to get in contact with you about this?
You can absolutely contact me, and I can bring that to the team. And so I just put my email in the chat. I'm so happy to talk with anybody. So please reach out.
Wonderful. Great. I want to thank Keisha and Susanna and Amanda again for your participation today. This was such a wonderful conversation, and just really appreciate all the work that each of you are doing in this field. And we thank you all for being on our webinar today, and want to thank all of our attendees today. We hope you had a really great time listening to us chat. So thank you all.